All right. So several days ago, I posted something on social media talking about a advanced comprehensive antiviral formula to help everybody right now, kind of just defend themselves and their immune system from contracting COVID-19. We're going through a global pandemic right now, and it's not getting any better. So there are things and there's steps that we want to take in the healthcare industry as clinicians to help the people, so that they don't have to feel scared, and they can go out in the community and feel a little bit better about taking certain things. So today we're going to talk to Kelvin Yu, who studies traditional Eastern medicine, and he has a lot of insights into what it is exactly that I'm talking about as far as like antiviral cocktails and things of that nature. So Kelvin studies microbials and immunity specifically, so he's the perfect person for this. And I just want you to kind of elaborate on what it is that you provide your patients with, and a little bit of background, maybe some research for the viewers, so that we can, build a little credibility with this as well. So go ahead, Kelvin.
Okay. Well, I've been an acupuncturist and herbalist for 13 years now, including my naturopathic background, which specialized in a great deal of vitamins, minerals, targeted supplements on top of, like I said, the current existing base of herbology. I did also go into genetic testing, so I know a bit about that as well. So it all plays into the holistic mindset of what we have to do. In light of everything that's going on now in the pandemic, it's more important than ever that we just build up everyone's innate immunity, which is the first line of defense that we all have. So, anytime something that we're facing now, it's completely new to the environment, completely new to our biome. We have to rely on our immunity for that initial defense. That's why certain people, certain blood types can help. I mean, it's a lot easier for them to get very, very sick. I think A blood type is the worst one right now. It also strikes men a little bit more because from the research, they have more of the ACE2 gene, which ironically helps with hypertension. It's a pathway, but this seems like more men have that. So we currently know statistically that 58% of the men have it get a little worse, as opposed to the women, 42%. And of course, your age is dependent on that as well. So anything, if your age of past 60, or if you're immunocompromised, which a lot of my patients are, we have to make sure we build up your innate immunity, because acquired immunity is what everybody is currently asking for, and in the form of vaccine. And you need to rely on your vaccine memory, because right now we're probably months, and I'm saying this optimistically, probably more like a year away from an actual vaccine. So that COVID-19 is going to come around, is without question. Now the only thing is, we are trying to build you up. When I say we, I go, myself and Angela, we're trying, and Angel, we're trying to build you up so that your body can withstand whatever comes its way.
Absolutely. So I want to point out too, something that I heard on the news, which could be fake news, but I don't believe so. So also African Americans have a higher chance of getting this virus as well. So just want to get that out there for people who might be watching to understand why certain populations are more susceptible, and what they can do to help themselves in their immunity. So thank you for distinguishing between the two different types of immunity. And so let's talk about what it is that you put together for patients to give them this cocktail, how you tailor it down to their specific needs, and what is in these cocktails and these advanced formulas that are going to help people build immunity, boost their immunity, and just prevent any virus from kind of penetrating the system.
Okay, it's a multi-pronged approach. I have a lot of antivirals. It's a blend of several of them that they've used in China successfully, and in South Korea and in Japan, where herbal medicines like this is very common. So I used several of those formulas, some of the cinnamon, I'm trying to think of the English names for it. It's a little bit hard to even understand, but astragalus is another one. I also pair that with, you've been hearing a lot in the news, chloroquine. So the anti-malaria drug, I use a natural form of that one. I use Jesuit powder or Jesuit bark. You have to pair that correctly with everything so that even if a virus like COVID does come into you, your body's able to withstand it because these act on the receptor sites. And just to also reiterate why I think that African Americans are more prone to it is because they tend to have a higher rate of a gene mutation in their ACE2 gene. It precludes them to higher hypertension, is angiostensin pathway. So it makes a lot of sense to me. The current medication they're talking about, chloroquine, targets that pathway. So I use a natural form of it and I dose it correctly based on your symptoms and based on your current health, because certain people with current heart conditions cannot take the current form of the anti-malaria medication without side effects. And the natural form is a little easier on the body.
Okay. And that natural form is called what again?
It's quina.
Quina.
Quina, quina.
And it comes from bark from a tree in
Yes.
Peru, correct?
Yes, correct.
So let's talk about, let's do a case study. Let's just, an example. Say I am a patient, I'm 50 years old. I have a past medical history of some hypertension that's controlled and maybe some type 2 diabetes. I have anxiety, depression, and I'm really high stress from what's going on right now in the world. What would you kind of put together for me to help my immune system?
Okay, first thing I'd get the stress response to come down a little bit because anytime you're in high stress, it releases a lot of interleukin 6 in your body, which upregulates inflammation. As we know, more inflammation, the easier the airway gets blocked, the more that your immune system is called into undue action. So I lower the inflammation right away. I'd ease the stress response with acupuncture.
So the cortisol, the stress hormone, that's what you're doing with acupuncture is you're bringing it down?
Oh, absolutely. Oh, yeah. That's the first thing that you have to do is lower the cortisol because that alone puts your body in a very inflamed state. That's why a lot of when you have cortisol spike, from acute stress, you're very inflamed internally, and you're more prone to have complications, even from simple viruses or bacteria. Not even just talking about our current pandemic. So
you kind of
I
put
would
yourself in a state to get, an immunocompromised state when you're stressed, and then you allow things to enter your system easier when you are compromised from stress. Yeah.
Yes. Absolutely.
Okay, so you would give this person, you would get their stress levels down, and then let's say they don't have access to an acupuncturist, or they don't want to go because they're afraid. Is there any other way that they could lower their stress, the cortisol and stress hormones and things circulating in their body to kind of combat it without having to come in somewhere?
Yes, I have certain formulas geared for that, chief among which ashwagandha is a very popular herb now for that. It's an it's a stress response modulator, so it's a push-pull mechanism therein. But I have several formulas geared just for cortisol, just for too much cortisol in people's bodies.
So what else would you be putting in this this formula for the person?
Based on their health history, clinical strength lavender, let's see, ashwagandha, holy basil leaf extract. I like astragalus quite a bit because that'll help boost the immune system as well. I like a certain emulsified form of oil of oregano because, again, that will modulate for immunity. And vitamins such as liposomal C, zinc to help build their. There's a certain form of zinc I like, zinc carnosine specifically, because that will help dual purpose. It'll help keep vitamin C in your system longer. And also, which there in turn help you fight off any type of pathogen, but also help build your stomach lining, your gut lining more so.
And then let's say somebody like myself who is young, 29, no pre-existing conditions, but I just want to boost my immunity to help myself prevent and defend against any kind of viral infection. What would you put me on?
Most likely a combination of vitamin C, D3 with K2 if you don't have any clotting issues, zinc, and maybe ADP. That's it. The emulsified oil of oregano, something very simple.
And where can people get these certain herbs and supplements and vitamins and such?
Well, obviously, I prescribe them myself because I use a clinical strength and I change the dosages based on case by case basis. How you are, your past medical history, what we know of your allergies, and what your current medications are. So your current medications that you're on and are effective will give me a clue, a pathway to where I could kind of steer your herbal treatments as well. So any lab work like that will help.
Yeah, that will definitely help to see your levels. Um, have you had any experience with any COVID-19 patients and putting them on something after, during their battle with it, during the sickness? Have you been able to get to any patients to put them on something, and have they gotten better if so?
I have. I have, and like I said, it depends the severity where they were, where the acute response were. I had a couple of patients that had fevers, dry cough, nausea, diarrhea, intestinal issues, and fortunately, the interventions that I had given them had helped a lot, and their fever broke within a couple of days. So I'm I could say yes, I've helped them symptomatically. Now, did they have it 100%? We're not sure, because they didn't get a formal test of it, but they did recover pretty quickly.
And so based on symptoms, you gave them certain different things to take, and it cleared them up pretty nicely. Is that what we're
Yes.
going with? Any research you want to talk about on any of these things that can validate credibility and just make people feel more comfortable? Or
Sure. I mean, the research, I go, if you look up the formulas that they used in Beijing and Wuhan, where the epicenter of it started, and they really got an incredible handle on it, on the front lines, along with doctors and nurses, were the acupuncturists and herbalists as well. So they had used formulas to reduce inflammation because that's the key thing, especially lung inflammation. And that's something that I also currently use. I have to moderate the formula based on what your body can handle and what they cannot. But that's, if nothing else, I'm taking their cue of what they've done and making personal tweaks to that based on case by case basis. So yeah, you could look that up online. There's formulas that they use.
you come in contact with these people, you're giving them their things, the prescription that you're putting together for them. So you've had to come in contact with these people who possibly have been infected. And now, are you yourself on any of these regimens? Are you yourself on these regimens?
Yes, I put a lower dose on it, just a lower dose, just to make sure I keep the viral numbers down, even if I do have it. That's why the difference in symptomatic and asymptomatic is when the virus will take over too much. So I personally take what I've given, just not in the higher dosages, and also to change the formula around enough so that it could be standard, so it's more preventative.
Right. So then you've come in contact with these people. You haven't had any symptoms. You've been fine. You've taken your temperature. Everything stayed stable. Do you credit that to what the supplements and the herbs?
I actually have to credit that because I actually personally have that one gene. I have that one gene for ACE2 inhibitor. I mean ACE2 morphology. So yeah, I could definitely say that I've taken precaution because I was in that subset of group of men ironically most susceptible to it. So I I had to take my own medicine to make sure that I was going to be okay.
Now, I have a couple questions from some people that wanted to know some answers. How long does it take for the cocktail to work into the system?
Usually takes about 2 days.
2 days. Okay, so in 2 days, we're pretty regulated, and it's starting to work effectively.
You,
Okay. What did you say?
like I said, it all depends on where the person is too. Some
Right.
people will, if it's very acute, it'll be less time, and if there's fever, it's a little bit different. So I have to change the formula enough in the dosages to see where the patient is at, and then make the adjustments.
Correct. So it's kind of just, there's a lot of variables to consider. Um,
Hmm.
so these are just general questions. And if you are someone like me, again, who just wants preventative, there is a solution for that. And Kelvin is taking it, and he has come in contact with people and is still fine. Not saying that this cures. We cannot say that, and it's definitely not a curative, but it's definitely an aid, a major aid in a major way to, again, prevent, and if you do have symptoms and possibly have the infection, to help you just get better in a timely fashion with less complications. Is that correct?
Yep, that is exactly correct. It helps. It helps lower the inflammation in your lungs specifically, and helps clear out whatever pathogen that maybe. It could be mold, it could be bacteria, it could be viruses. We don't really know. It could be even seasonal allergies. So that's the first thing I look for.
Okay, some other questions. Will I have to take this continually, and how often is the recommended dose?
The recommended dose, probably for about a month or so, and after that, it's probably not going to be that big of a deal. I
Basically,
don't
during
see
flu
this.
season, you really want to be hard on this. And
If
it's
it, yeah, if
coronavirus season, so basically everybody needs to be on these things and target their certain issues, health issues with whatever they need, and get on these things right around flu season, right as the seasons begin to change and it starts to get a little bit colder outside. So that's
mhm.
definitely, it's not an everyday thing and the rest of your life thing. It's a seasonal thing.
Yes.
Does this cocktail help boost my immune system against any other specific illnesses or viruses? Yes, because it's
Hmm.
boosting immunity in general.
Yes.
If I'm experiencing symptoms, then start taking the cocktail and see significant improvements. Am I still putting others at risk by interacting with them? How long should I wait after taking / experiencing improvements to interact with others?
You have to give the 2 weeks. You still have to do 2 week time
Only
period,
quarantine
especially if
symptoms
it's.
change. Quarantine yourself for 2 weeks. Take this stuff and do your due diligence, people. Are there
Hmm.
any age restrictions on the products? Infants and elder.
Okay. Infants have to scale way down. It's usually not a problem with infants, meaning like even if they do get it, their immune system is very highly tuned. Their bodies are very adaptive. It all depends, like I say, case by case basis, what other comorbidities you may possibly have. So pregnant women cannot take it, unfortunately. Off the top of my head, certain people with heart conditions we have to be very, very careful with. So again, everything is custom tailored.
Right. And then obviously anybody with kidney, renal issues is going to be of a concern as well. And is this purely a preventative or is it a treatment too? So we already answered that. It is more of a preventative. It makes you healthier and assists with recovery if you do happen to contract it. But you're likely not going to contract it if you're already on it. But if you're not on it and contract it, it's going to help mitigate symptoms. Now, I want to just say one thing before we end here. These types of herbal supplements and different variations that you combine, they work at the cellular level in the DNA and RNA, and that's what is necessary. A vitamin ain't going to do it. You can take vitamins every day. Actually, multivitamins have been shown to not be very effective. There's very, very mild, if any, benefits coming from that because you excrete most of it. So guys, vitamins are not a healthy thing. You're not going to go to CVS and buy a $12 bottle of gummies and be healthy. That's just not the answer. You need something that's going to penetrate into the cellular level, be able to cross that barrier. So it has to have specific solutions within it for it to be able to penetrate that barrier, to get into the cell, the nucleus, the DNA, etc. And so I just wanted to clarify that because that is where the magic happens, right?
Yes, and what I use is targeted. It's clinical strength, and there's a lot of validity towards what you just said there. Multivitamins, especially from synthetic forms, are usually just excreted straight out. So you need the right forms and the right dosages and the clinical strength dosages in order for it to have efficacy. That's just how it
And a
goes.
lot of things that you give, they're sublingual, which means droplets under the tongue. So it is a totally different way of ingesting and absorbing these products. It's not, we're not taking a tablet. Some might be, because that's okay, and they're able to be absorbed highly effectively. But a lot of things that are droplet is going to enter the system much more efficiently. So again, vitamins, you just pop one in your mouth and swallow it. It's not effective.
Yes.
So anything else you want to cover on this topic before we end?
No, I think we've covered a lot of it. Like I said, the main goal is to make certain that we boost your innate immunity the best we possibly can to fight this off. And, there is a very difficult question, it's like I said, case by case basis. If you have a current autoimmune condition, do we want to tune it up that much? No, you cannot. You have to regulate that enough and then have it still functioning against the virus.
Now, Kelvin, if somebody wanted to get their hands on, some of this stuff, or maybe come see you, they live in a different state, or they're scared, they don't want to come in. Do you do telehealth consults for people that would like that, and you just review blood work, ask them some questions, and then come up with what they need, tailor it, send it out? Is that possible?
I do.
Where can people find you to access you?
You call me directly on my cell phone. It's 561-866-8814. Number again, 561-866-8814.
You can also contact me. Kelvin is a colleague of mine, works in my office. So that's just another form of communication if you want to have yourself looked at, have your blood work looked at, and he can find what's right for you. So thank you so much, Kelvin, and have a good rest of your day and stay healthy.
You're welcome. I'll talk to you soon.